there's probably a lot of learning coming around the corner for me, but you know, at least now I'm in the mode. I've got a better understanding, and I've got a want or a desire to understand.
Andy has been battling obesity his entire life, as most of our patients have. His weight topped up at 580 when I saw him, and this isn't the highest that Andy's been. He's been even higher than that. And in his mid-40s, Andy recognizes that the obesity that he's had is slowly killing him, and that's the truth.
It's not something you do willingly or purposely. It's like as if you don't have control of it at times.
Everybody in the medical field who understands the scientific literature understands that for a person in Andy's position at 580 pounds, his best chance to survive long term is bariatric surgery.
The surgery is something that I need because of the degree, the degree of damage I've done already.
He has obstructive sleep apnea, so he has to wear a CPAP machine, which is a breathing machine that he puts on his nose every night to be able to keep his throat open. Otherwise, his throat closes down on him and he stops breathing. He has high blood pressure. He is at risk of having diabetes. He has bad knees and difficulty walking, although he's been able to continue to be employed, which is a terrific credit to Andy.
I'm 48 years old and I walk like a 90-year-old. I mean, it was to the point where going to work was just cringe. My bosses would just feel like shit about getting me to do my job. You know, they worried about me. They spent a lot of money trying to find the answer with me.
He came to me and said, I need help. I need long-term help. I don't need to lose 100 pounds quickly or even slowly because I'm going to put it back on. I always have. I always will. I know how to lose weight already. You don't have to show me how to lose weight. You need to show me how to keep it off. You need to help me to keep weight off long term so that I can gain my life back.
People look at me coming down the street and, you know, I'm one of the society's write-offs. You know, the guy's just out of control. There's no sense wasting time with him. He's done. He's finished, you know. I'll let you know right now, I'm far from finished, but people don't see that. A lot of people don't see it.
So the meal replacements with high protein, because it's hard to get that much protein in regular food. Mm-hmm. So you'll oftentimes have to take that supplement to be able to get in enough protein to be able to get that energy back, because your stomach's. The bottom line is that, and as of today, the most effective method continues to be surgery. As of today, there's no real comparison between the medical interventions, lifestyle interventions, and the surgical intervention. Surgical intervention wins hands down. You started this process last year at around 590 pounds. We put you through almost a year-long process of eating the right foods, getting the right weight, getting your liver size down. So let's see how much you are now prior to your surgery. It takes people 20, 40 years to get up to the weight that they're at where they're seeking the treatment that they're looking for. So to be able to turn that around in a couple of months, which is what many people are looking for, is a major challenge. Looking at 3 weeks until your surgery happens. And Andy, all this weight here, all this excess weight,
yeah,
I want you to say goodbye to it.
Yeah, I will.
I think things are going to go in the right direction for you.
Yeah.
So
if it's anything like the difference between the 590 and now, the energy level, the difference, if it's that much difference again, there'll be no stopping me. Look at it. I won't know what to do with myself.
We're going to take care of the diabetic patient and of the cancer patient at the same way we should take care of the obese patient, because it's not a social problem. It is a medical problem. It's a result of genetics that have been overexpressed in the society that we currently have. Therefore, if we can take care of their obesity, we can decrease the risk of them having diseases such as diabetes and high blood pressure, heart disease. As a result, they're more functional in our society. We have more productivity. and we care about the people who live in our country. I believe strongly that we will come to grips with the fact that it's our responsibility as the government and as a society to take care of severely obese patients.